Welcome back to the Beats with Kelly Kennedy, from our heart to yours. And for our fifth episode today, I'm so excited to bring to you Dr. Ralf Oettmeier from the LYMPH Clinic in Switzerland. And Dr. Oettmeier is a double trained in biological dentistry as well as biological medicine. He's an amazing medical doctor. He deals with many cases, chronic cases from all over the world. And I am so fortunate to call him an incredible friend and colleague. And when I put this platform together of how the body really works, I knew I wanted Dr. Ralf to be part of my initial offering to you all here to get you to understand the autonomic nervous system, how the body really works, and how you don't have to be afraid of anything because you can armor yourself with information. So without further ado, please welcome Dr. Ralf Oettmeier. We're going to call him Dr. Ralf.
Thank you so much for this lot of sweet words. It's more than honey around the mouth. I thank you so much. It's a big honor to be here. It's wonderful to see you. And I would like to support, of course, your wonderful project. I appreciate your projects, your center, which I have seen before. And I thank you so much that you invited me. Thank you.
Well, thank you so much. And you know what Dr. Ralf has done with many of his team, he's got an amazing team behind him as well. Dr. Kelly, who will be on one of our other podcasts for the dental piece, but he's got a lot of other people on his team. And what we're really talking, and what I'm going to ask Dr. Oettmeier to talk about, is the concept of bioregulatory medicine and how that might be different from what so many people in the United States call functional, holistic, alternative. You know, they find that these names are the same. I don't find they're the same. Integrative, functional, holistic, alternative does not denote bioregulatory and biological. Can you speak to that for a minute for us, Dr. Ralf?
Yes, it's clear that there are also, when we look for this different words and topics, there are some overlappings. But according my knowledge, functional medicine, also we have in the conventional medicine some functional parts. Means that we speak about functions like the digestive function, like the function to sleep and to recover from different problems. And we have also a lot, meanwhile, of test devices which give us more information about the function of this or of other organs or systems. But when we will treat successfully also severe problems and then chronic and modern diseases, which are not so easy to solve, we should go, I would like to say, one level more in the deep. We should look more for causative factors, which are the true reasons. And of course, we will use the ability of our body. This is a biological law to regenerate with its own healing forces. And in this direction, we should not look only for the function. We need more information towards factors which are typical causative or also inhibitive factors for causing problems and diseases. For example, we should look more for toxicity. We should look more for the appropriate vital substances to have best conditions for the cells to recover. More or less all structures and cells can recover. We know meanwhile also from the brain, from the cartilage, and also from other structures which are able to regenerate. And in this direction, it needs more. Yeah? Functional medicine is a good one. It's for me like a bridge between the more static, not so dynamic, also things which they mostly use in conventional concepts. But with the bioregulatory medicine, we have much more know-how and instruments in our hands to be successful.
So your English is phenomenal, by the way, and I just want to, but I still want to reiterate for some people that might not be used to listening to that. So what you're saying is that we look for causative factors, correct? And yes, when somebody comes in with a disease state or a symptom or whatever, we're looking for, well, there's what you said was so brilliant. There's the healing capacities of the body, and our job is to figure out, is there an impediment or a blockade? Yep. And does that have everything it needs to heal? Because that's the only thing that heals. correct?
Yes,
You may
absolutely.
still look at the function of the organ systems and look at different testing. And, you are a medical doctor, so you look at, I'm sure you do, I know you do blood work because I've seen you do blood work. It's amazing to watch you read blood work. And you do, fatty acid profiles, and you do, metal tests, and you do all sorts of, regular tests as well, but you're also doing regulatory testing. Can you explain what regulatory testing is?
Yeah, it means this contains the mentioned dynamic component. Yeah, for example, you like it also, I know, Kelly, from you and from your work, when we look in a fresh blood drop, yes, we can see many things, especially we can make an assessment of the quality, and then we let the blood drop between the glasses lay in a corner for some hours. And this is a stress for this blood, for this little system, which contains a lot of structures, cells, and also extracellular components. And after some hours, we make a assessment. We look once more on the microscope, and then we see how the stability is, how the dynamics in this little system is working. Or on another side, I like very much also biothermology. Yeah, it's a measurement of our temperature pattern, but we make it not only one time. Yeah, we make it after.
We're both talking, but the thermography, just so people are listening, can hear that.
Yeah.
So we do computerized regulation thermography. They do it's same test essentially. It's just
this I mean.
So go ahead.
Yep. And with the thermography, we see not only the pattern after one measurement, after a short stressing thing that the people have to stand in a cool environment for some minutes, we make a re-measurement. And then we see how the regulation is of the vascular system, of the lymphatic system, and also of this so-called reflex zones, which you have all over the body. And with this dynamic additionally information, we see how the system is able to regulate. Sometimes we see also chaotic regulation. This is a clear information for us. Okay, there are big systemic problems and irritating factors around the patient.
So let's back up for a second. Let's say this is somebody's first access to what bioregulatory science is, right? We're talking about this word regulation, and we live in an environment right now where there's a hell of a lot of governmental regulations. So can you speak to what you mean by regulation, this concept of regulation? I mean, I've explained autonomic nervous system for years, but I'd love to hear it from your mouth.
Yes, I think it's super important in this situation to mention the vegetative nervous system. We say also autonomic system, or we say also unconsciousness system, which is also working when we sleep or when we not think for our heartbeat or for our digestion and so on. And this vegetative system, we have two arms. We have the sympathetic and the parasympathetic system. Makes this regulation. It means adaptability. It means that we, depending from the situation, change something. We can, when we run or when we will go faster than the heartbeat, the circulatory system must do more. And then this subconsciousness system, using a lot of inner software from our high-level biocomputer, is then adapting for it. And this adaptability, this variability, also depending from the situation, we should bring in a high level. And this the patient can feel when it works well.
And the regulation, the adaptability, what's key about what you're saying is that every single thing in our life we have to adapt to. Everything. Yep. Not just running though, right? It's like the lights in here, the temperature in here, what happens to me out there, if my phone's ringing, every single aspect that our body perceives, it has to adapt for. And if it can adapt well and continue all the functions, then we have health. If it can adapt for some reason, then we start to see signs and symptoms of this dis-ease and illness, right? And then you test that. So a lot of people do a what's it called? A thermogram versus a thermography, right? They take a picture of the breast, they take a picture of the body. And for me, that's not nearly as sensitive as a test that's testing what your adaptation is, because nobody's static. Nobody just stands here and goes, okay, I'm here, that's it, I'm healthy, because we're ever changing, ever evolving, ever dynamic. So when you look at the blood, live blood under the microscope, or I do, we look at it now, and then we look at it 2 hours from now, 4 hours from now, to see how well it how much it changes, because that indicates to us how fast they're degrading, correct?
Yeah, absolutely correct. And we need both. Yeah, I appreciate also the imaging, the methods like ultrasound, sonography, CT, MRI, and so on, to know which especially organic changes the people have, if there is a tumor, if there is a big inflammation, and so on. And these things we use also. That's why we say also we are an integrative part of this medicine system in which we live. But this static things, they show us only the situation of a moment or of a day or 1 week before and so on. But our regulation, how we discuss together, is under a permanent flow, we can say. In Old Greek, they teach us pantarei, I think it's correct, I hope, from pronunciation. It means everything is permanently in a flow, yeah, and must be. And in Chinese medicine, you know, Kelly, they say the Ji energy should be permanently in a good flow, and going through the meridians and the inner systems.
And you don't know this, but I've created my own technique called flow.
Yeah.
For fascia lymph overall wellness.
Yeah.
And I incorporated a new technology from New Zealand called Flow Prezzo to help open up the fascia and lymph, because what I've learned from you and so many of my other mentors and colleagues is that if you open that fascia and move the lymph, oftentimes the toxins will drain out faster than they're coming in. When you've changed the lifestyle, you've gotten rid of any kind of impediments like scars and dental influences, and then the body can have wellness. But this is a key concept I want everybody to understand. If you can accept viruses, bacteria, fungus, molds, the immune challenges of life, the metals, the chemicals, the emotional stresses, and that can flow through you, then you're going to have health.
Yeah, it's exactly. Yeah.
And how can you tell if you're regulated?
You mentioned the immune system, and in times of coronavirus and so, which gives us also the chance to bring it more into focus, how intelligent and how wonderful as a result of the big creation our immune system is working. We have a permanent input output, a permanent also relationship which the immune system must organize. You know, we have different systems. We have cells, they fight more against bacteria. After we appreciate lymph cells, they fight more against viruses, but we have also a big amount of bacteria and viruses. Some days ago, I have seen a movie from a Harvard University professor. He calculated we have permanently millions of viruses in our body, but despite of it, we feel and we are healthy when this immune balance is realized. Yeah? And of course, we have also many factors they can irritate and they bring it out from the steady state. Yeah? Also, anxiety belongs to it. Yeah? Also, big stressful things belongs to it. And of course, there's many things which we must tolerate every day, also from the environment.
And so this concept of regulation is that can we adapt or can we not? And so testing that ability is very sensitive, and testing if we can adapt. And you also use heart rate variability as well.
Yeah, for example.
Another way to test the nervous system, the autonomic nervous system, and to see what the health of the person is like. And then you may also investigate further. Well, you always investigate further with all your other blood labs and MRIs and CT scans and cone beam x-rays, or cone beam, what's the word I'm looking for? Cone beam.
Yeah, I know what you mean.
The cone beam CAT scan to understand what's going on in the whole body, because the teeth, you know, I mean, we talked about this, Dr. Caratola was our first podcast, but, you know, I know that at your center, you cannot work without a biological dentist. And you're one of the very few centers that has both the medical and the dental in the same facility. And why did you do that?
Yeah, because we cannot survive without, I would like to say. Meanwhile, in this so-called biological world business, I'm working over 30 years. And the first years I will be open, I have a bit neglected the dental field, and I had the thinking, okay, perhaps it works also without to pay too much attention for it. But step by step also teach from patients which have used the dentistry parallel to us. I have seen, I have learned that the recovery time very often was much more faster, and that the success rate increased with it. And that's why it's an absolute logical following, and I'm a biological doctor. That's why I like logic things. We have it integrated. I'm very happy to found a person which is also well adapted to our wishes from the medical part. And we cannot, how Joseph taught us, you know, Kelly, we cannot cut the head from the rest of the body. Yeah, okay. In the head we have also a bit brain, but we have also a big amount of teeth which are tight connected with the brain, with specific nerves, and at the end everything is connected with everything. We have also then many relationships using this odontomas to the body. And it's a routine, and when we have a new patient, we look for this field additionally. And this is very fruitful. I hope this word is acceptable in English. Fruitful, because it makes the concept more easy, and more also shorter will be then the recovering time which the patient needs.
So essentially what he's saying is, in your training, if you could tell everybody, as a medical doctor, was in what field? In pain, wasn't it? A pain, orthopedic pain specialist? What's your training?
My primary field, you mean?
Yes, your
yes, orthopedics, yeah, orthopedics,
yes.
and also pain management, yeah.
Right.
And this field I made some years, and more when you have some good ideas, and when you think more complex, then more and more also problematical cases will come. Yeah, not the easy things, more the problem cases, and then you have to look for better solutions, and you need more things in your hand to solve these problems, and it needs then also such cooperations with other fields, inclusive the dentistry.
And I know at your center, it's not just, you know, you as the medical doctor and the dentist. You have many other practitioners that are doing all sorts of therapies for the lymphatics, correct? Because the lymph is so key in regards to the drainage. Because
I'm a big fan of lymphatic system, as you know.
So can you talk about the lymph a minute? Because everybody hears me talk about the lymph in the United States, and honestly, I feel like there's 3 of us here that are talking about it. And by the way, we started a flow show. I'll have to send it to you. We have 4 episodes now, and it's 10-minute show every week on YouTube just to talk about the lymph for nothing else. And maybe we should interview. I would love to interview you on our flow show at some point, but please talk about the lymph. Dr. Ralf wrote a book called Say Yes to Life, and it's absolutely amazing. And he's got 3 little characters, toothy, lymphy, and nervy, that explain how the body really works, because it's about the nervous system, it's about your teeth, and it's about your lymph. So please talk about the lymph.
Yep. About the lymph, I think in some sentence, it's one of the most important functional system which we have in the body. It's much bigger, also from the amount of muscles and of the amount of fluid in comparison with our blood system. The blood system, for example, has approximately 5 liters. The lymphatic system, depending from our size, has 25 to 30 liters. And it's more or less starting in the space between the cells and the periphery, and is then with so-called lymph collectors, then collecting also the fluid, inclusive the things and the biological waste, which we must transport away from the area of the cells to the organs, which can able this also to excrete. And then in the lymphatic system, we have the lymph cells. For example, the coronavirus main defending cell, the lymphocyte. It's tight connected with so-called lymph organs. We have primary lymph organs. This is the thymus here, then the spleen on the left-hand side. It's the bone marrow, yeah. And then also some people, they say also the intestines belong to it. And then we have famous secondary lymphatic organs beginning in our mouth, the tonsils, yeah. We have then in the belly also a so-called tonsil with the name appendix, yeah. And then we have some lymphatic islands in the wall of the intestinal system and in the liver too. And at the end, when you look also carefully for all these components, you will develop a big appreciation. Oh, the system till now I have a little bit neglected. This is not acceptable. And when we are fit with the lymphatic system, we feel also better. We are younger, and it has only advantages.
The lymphatic system has many organs and many sites, but it has 5 times as much fluid as the blood, is what you just said, right?
Yeah.
From our small intestines to our liver, to our thymus, to our spleen, to in our mouth, we have lymph cells everywhere, and they're also in the nerves as well.
Yep.
So you can see them around the Schwann cells where you have the lymph.
Yes, in the brain we say it's the glymphatic system starting with G, and it's a little bit similar. And due to the modern research towards Alzheimer's disease and Parkinson's disease, more and more we learned also that here a good drainage is very helpful. This we can realize with our natural also medicine methods. And when you allow me to give you one more number, for example, this very famous defense cell, the lymph cells, we have only 3% in our blood. The rest is outside from the blood vessels and circulating in the lymphatic vessels and in the lymph nodes. Also the lymph nodes we must mention, of course, because these are big homelands, I would like to say, of lymphatic cells.
I just have to because I just happen to have this in my room right now. So let's talk about the lymph.
Yeah, wonderful. Mm-hmm.
Okay.
Yep.
So you have a largest concentration of lymph nodes in areas where you have joints, and they're deep lymph and they're superficial lymph, right? And so look at all the lymph nodes around the neck.
Yep.
And up in the head.
Yep. Super. Very good posters. Yep.
Well, you gave me my posters.
There's another lymphatic center in the area of our belly, of course, and especially in the inguinal area. Yeah, we have a lot.
Yep.
And we have in the body approximately 800 lymph nodes with different size. And not all swellings are negative. This is also an immunological reaction. It's clear. Yeah.
So many people are talking about the immune system, and I have postulated that you could just talk about the lymph if you want to talk about your immune system.
It's more or less the same, yeah, because the most of the immune cells are more circulating in this system, yeah, and this is also a very intelligent situation. Yeah? They use only, this is perhaps a good typical men comparison, they use only the blood vessels to be faster to come from one point to another place. But then they are able to go out. Yeah, we can see also very good in the microscope. Then they are able to go out in the tissue, and then here they look for things which they can do, or which waste must be transported away, and so on.
So just so everybody's clear, the cells are, again, 1/5 of our body, and there's all this space around the cells, and that's where the lymphatics live. And so when the cells are dumping stuff, the lymph has to move it up through the body, and then it gets dumped into our cardiovascular system. The cardiovascular system circulates that throughout the body, and we excrete it out. We pee it, we poop it, we sweat it, we bleed it if we're still of menstruation years, and we breathe it out. That's how it comes out. That's it, right?
Yeah, but you mean the different ways to bring out the biological waste. Yeah, this is clear. Yeah, this different excretion systems we have. but partially also the lymph cells self. We have, for example, this macrophages. I hope the pronunciation is correct. They are, yes, also cleansing the systems, and then they bring it to different places to excrete. Yeah? This is a very intelligent system in this direction, which we have too.
And that's something really to be honored and really recognized by everybody. Please understand that it is not up to you to identify what your immune system is being attacked by, either internally or externally. It's up to the intelligence of the body, and it happens at the level of the lymph nodes, which are deep into our joints, where and in the tonsils, where the lymph nodes identify what that immune challenge is, what that toxicant is, and then based upon that, it will then produce the proper fighter cell, the white blood cell that's going to go and get that. And then it's going to, and if those lymph nodes don't work, and how would somebody know if they have a lymph problem? I didn't expect this to turn into lymph, but this is great. How do people know if they have a problem in their lymph? Do they have to have lymphedema? Do they have to have swelling?
Yes, the most common thing is the lymphedema, the swelling, very often the periphery, very often in the lower part of the limbs, for example, or some body has it also, or feels it also in the hands and in the fingers. But this is only one part. Very often we feel also a blockage of this lymphatic flow in our area, in which the lymph vessels, how you mentioned, are more superficial, like in the neck or like in the inguinal area, that we have the feeling, oh, there's a swelling, but from outside we see not so much. And so I say to the patient, when there are many cables going through and when there is not a good flow in, then it's clear we feel it's like a thickening. And in this direction, we pay attention for special infections, which very often are responsible to irritate lymphatic system, you know, Epstein-Barr virus, cytomegalovirus virus, and so on. And another typical symptom from my perspective is also the fatigue problem. Yeah? And also another typical disease which is connected with lymphatic system is the fibromyalgia. Also here it was shown by research that especially the small vessels and the circulation in the subcutaneous area and around the muscles is showing disturbances.
Yeah. So many people are talking about detox, and what I've learned from you and so many others, and it gets reinforced every time I talk to you, is it's about drainage, not detox. If you allow the drainage, the body's own ability to detox will handle it itself. And you don't have to take 1,000 supplements to get the body detox if you properly drain. Do you feel the same way, Dr. Ralf?
Absolutely. When we speak about this topic detox, at first it's important to understand it's the same like in a house or in a kitchen which is dirty. At first we must open the doors, the windows. At first we must open the organs to be able to bring it out. You can swallow a lot of things and things which shall be good to detox, but when the doors or the gates are closed, like the intestines, like the kidneys, like the liver and the gall, you can forget. And also, you know, some people are not able to sweat. Yeah, in this direction, also this possible system to bring out toxicity, the skin is not able to react. And in this direction, we must pay attention. And that's why we like very much such methods like the colonics, yeah, to open the big also doors of the intestinal ability to bring substances out. Excretion liable substances, we like to say. I hope it's also acceptable and correct for you.
Substances, things that are going to promote excretion. So colon therapy, coffee enemas, castor oil packs, in addition to lymphatic manual pumping and all that other. So that was amazing. That was amazing.
Or you can make also this cupping, I think, from Chinese medicine.
Sure.
There are different ways, of course.
Right. Vibration platform.
But it's important to bring both components together. You must open the doors and then you must mobilize the substances that they come out using this open doors.
And if you could just back up a little bit, I mean, that was awesome, first of all. I mean, I really think people have a much better understanding of how their body works after that than they have. But give them a little sense as to how you got involved in biological medicine. And I know that's backing up a little bit, but give them a sense as to why you went this way versus staying in the more allopathic approach. How did you end up here?
You mean why I prefer more our kind of medicine and thinking?
Yes. Yeah.
On one hand side, it's important to underline we need also the colleagues from this special fields. Yep.
Yes.
Like the eye doctors or doctors which look only in this and this and this point. And then sometimes it needs specialists, but for the most cases we need not so much, because following this biological rules, following this biological or laws which we have, we are in most of the cases very successful when we have a clear concept at first, that we look for causative factors, which are in this case the key of the solution. And then depending from the results, we start with an individualized program. And I like very much, and in this direction I have sometimes problems, especially with internal medicine, the logical thinking. Yeah? Because when I have a toxicity, it's important to bring the toxins out. Yeah? When I have a lack of vital substances, it's important to bring these substances in. Yeah? When I have chronic foci or interfering fields, we say, meanwhile, in science, we say neuromodulative triggers. Yeah? When we have such factors, then it's important to treat. And then when we make such things, the body is able to make the rest work self. He is mobilized, he is motivated to let work his own healing energy and his own healing forces. And this logical work I like so much. Yeah? And then that's why sometimes I have no understanding when the colleagues give poisonous things. Yeah. Also in cases in which they have not a clear idea why or the person is suffering. They try it. Yeah. And I'm not a fan of tried things which are at the end also connected with side effects.
Right. And so when you're working with a client, so just to clarify for folks, you might have 3 clients that walk in all with the same exact diagnosis.
Yep.
Call it stage 1 breast cancer. Okay. Or
yep.
3 diabetes patients. Will they all have the same treatment protocols? Like the 3 cancer patients and the 3 diabetes patients, because of their diagnosis. My understanding from what you just said, and I already know the answer, but I want them to understand, those 3 patients with diabetes, will they all have the same treatment protocols?
No, they have not the same treatment protocols. They have the same structure. Yeah, and we in the Alpstein Clinic, you know, we have a so-called 4-pillar concept, which is more or less very similar. Also, when we use it for the patients, at first we look for causative factors. Then, depending from the result, we make the cleansing. The next pillar is then to support the regeneration. Yes, and and finally the harmonization and the increase of awareness, yeah, to bring in also more mind and emotional levels in the holistic treatment process. But when we have 3 persons with perhaps also the same or similar deviations of her blood inflammatory parameters, it can be that one person has in the foreground a toxicity, another person has in the foreground a lack of anti-inflammatory factors, and the number 3 has perhaps primary very deep emotional toxic problem. We have also emotional toxins a lot around, not only from chemistry.
And this is hugely important for everybody to understand, that you might walk in with the same diagnosis as your counterpart, but your bigger piece of your puzzle, like everything's multi-causational. Never is it one thing that causes one thing, right?
Yeah.
But your biggest piece of your puzzle might be different than your counterpart. And so if they just treat you for the diagnosis, they're not treating the individual. And what I believe the Alpstein Clinic has done, from my understanding from the pictures, I have yet to get there. I was supposed to come in September. Hopefully that will still happen. But you know, you've gone to an extreme beautiful process at your clinic to organize the clinic with color thoughts, with how it's laid out. Can you speak to that fourth pillar, that emotional pillar, and how you support the client through that process at your, just the setup of your clinic?
Yeah, the main point is, and that I know the words you have laid on your tongue. Important is that you make everything also with love, that you make everything with empathy, and that you follow a kind of a passion of the medicine which you like, and that you let spring this fire to the patient. Yeah. Or jump, or perhaps you have better ideas to explain. And the person from the beginning must feel that she is standing in the foreground, that she is in the focus, that she is important. Yeah, the best would be to feel like a little queen or king, and we are around to make the best that they feel also very good. And it's possible also when you make things which are not so super attractive. You know, I'm a big mosquito doctor. I like very much injections. Also, this you can take with empathy, with love. Yeah, that you connect it very clear with the willing, and that you transport it to the patient. I would like that this injection is helpful. I would like that this acupuncture session is helpful, and so on. And with this process parallel, you mentioned it, you are able to stimulate in the patient self this higher level of personal and of healthy awareness, because we need also not only some good effects during the time here or when the patients are in your office, we would like to have that they continue the improvement, that they are able to stabilize also the situation when they are outside from us. And this is only possible when they have her eyes true open, when they have a wide also perspective to look in your daily routines and lifestyle. And this awareness at the end, I think, is also the key for a long sustainable situation. Yeah.
And that is amazing.
This I think is the key.
Totally, because that's what your book denotes. Say yes to life, have joy in your life, figure out how your body works, and stop being dependent upon a practitioner, a science, or anything. Just go change enough that you're not dependent upon us. That's a totally different philosophy than allopathic medicine, where they go, we're going to get you on this one drug, and then when you're done suppressing that, or you're tired of the symptoms, we'll get you on the second drug, and then you can't get off of that because the organ's never going to regenerate. Once you have a thyroid problem, you always have a thyroid problem. Do you find that to be true? If you have a thyroid problem, you always have a thyroid problem? Or do you, can you turn thyroid problems around, just out of curiosity?
Yep. Yes, we have also very often thyroid problems, more and more also autoimmune problems like Hashimoto and so on. But this is only a typical example of many other things which can happen. And the thyroid is not an isolated little organ in our neck. Yeah, it's connected with many structures around, and like our glands, the thyroid has a structure like a sponge. Yeah, you know it also from this famous TV with the SpongeBob and so on. I know, but this sponge, spongy, I think you say spongy structure, is also a typical feature that the glands like to collect many things, also the poisonous things, and that they are not so easy able to let it go, to get rid. Yeah, and in this direction, it needs more efforts, and so also our neural therapeutic injections, other things are very helpful here.
And the way, when you say that you put that patient in the center stage and you make them the king or the queen, what your meaning is, and I want everybody to understand this, you have a suite of practitioners, like 7 or 8 practitioners, that will sit around a table and with one patient and discuss one patient's case. When you have all the specialties, the medical doctor, the hydrocolon therapist, the lymphatic therapist, the dentist, and whoever else that you have on your team, that's going to look at this whole piece and go, okay, what parts are we all doing together so that we as a unit can help this one person? Because we take one person that has the diabetes number 1, 2, and 3 have it for different reasons. Let's help them do this and then give them less dependent upon us because they know how their body really works now.
Yeah, I'm very happy about my team, about my colleagues. Yeah, I have also a specialist which is more diagnosing and treating young patients from children and adults, you know, Birgit, or we have a general practitioner with Heike. And then in the next days, another colleague will start coming from pain therapy and anesthesiology. And then we have, of course, the dentist, and then the wonderful team of two healing practitioners and nurses and also physical therapists. And you mentioned it for the problematical cases, and especially for patients coming from other countries, on one appointment per week, we make with them a so-called consilium. Consilium is a Latin name like a board meeting, perhaps we can say. And then it's wonderful also to collect the experiences, the ideas of the team, because the more you have complicated, not so easy solve cases which are easy to solve, you need more know-how. You need good ideas to be more successful. And for the future, I'm sure you have similar ideas, Kelly. We can use. It was well trained during Corona crisis. Also, such instruments like Zoom, like Team, like Skype conferences to make it also more internationally. Yeah, and why not? We can perhaps 1 or 2 days per month. Perhaps we meet us together with some patients. We exchange before the knowledge which is available for the patient, and then we will find better solutions. Such things are wonderful, possible to realize using this modern communication technique.
And that is such an amazing thing. Yes, I know Dr. Ralf does plenty of telemedicine. He does consulting, but he also not only consults clients, but he consults clinics and works with, because
wonderful idea.
What we're really excited about is spreading this knowledge so that people don't sit home and feel victims to, I have to stay in my house because I don't know how to not get that virus. I mean, I know that we have, I don't know, 1,500 active patients at our clinic. And we have one that tested positive for COVID 2 days ago for the first time. How about you? How are you doing in Switzerland?
Oh, in Switzerland, we have very, very low numbers. It depends a little bit from the area. We had in March and April some problems with the area around the famous city Geneva, and also in the Italian part, which is very near to the northern Italian part, which had this big amount also of deaths. But I am living in the eastern part of Switzerland, the so-called Appenzeller land, and we have more or less nothing. But this is also caused by our wonderful environment here. We have a very clear air. We are on an altitude of around 1,000 meters. We have no problem from chemical factories with any loads from toxic substances around. And our also population here, the people, they are very open for natural medicine and for natural lifestyle. Yeah. And then we made, in the beginning, we made intensive promotion concerning using good vitamins to be well prepared. And in our district, it's unbelievable for you, Kelly, we have since March only all together in 2 districts, inner and outer road in Appenzell, 3 deaths, I would say with Corona, not caused, with Corona, of a 94-old woman and of 2 88-old men, and not more. Yeah. And the whole country, Switzerland, we have officially 1,900. We have also not such a high number of population like you in the States. Sure. But since many weeks here is nothing. That's why we are very happy. We have the normal life back. We can do everything. It's not necessary to use any mask and so on. And we very hope for you and for your people in the US and around that you will reach it very fast again. But on another side, we know that the virus is at the end only a symptom. It's not the causative factor. It's only the point of the eye, we say in German language, that the system is destabilized.
And I'm so glad you brought us back to that, because I really think that that's what people need to understand. This is a tipping point. And if you're worried about the tipping point, then you have not done enough shifting in your lifestyle and how you live your foundation to be concerned about the tipping point. Because whether it's the coronavirus, it's an extreme trauma of stress in your life, it's some other kind of influence, a scar, something's going to tip you over. And this virus is morphing and changing every single day, just like we do. So they want to come up with a vaccine, which makes no logical sense to me for many reasons, because a vaccine, just like a cure for cancer, it's just the wrong paradigm. It's just the wrong concept of how the body works. And your immune system is designed. That's what we are. But our body from our head to our toe is designed to deal with bacteria, virus, fungus, and molds. And if we can't, then that is something going on internally. It's not about the germ outside of us. It's the internal terrain. It's the internal environment. Will you say the M word? Because I don't say it very well. How do you say say that?
Yeah, I can only underline, you have totally right. And in our last newsletter, we wrote a little chapter about this topic, vaccination and the coronavirus vaccination. I'm sure there will come something, and it can happen that some countries decide to make it as a must for the people. This is very terrible, this idea. Here I very hope for the democracy in Switzerland and US and so on. I'm optimistic. And we have shown also in this description in the newsletter that we have so many factors which are influencing the success towards a vaccination. It's not possible to bring it in a clear form. And the interesting thing is, you know, coronavirus, most of the victims were elderly people, were sick people, were people with so-called risk diseases. And when you look in the research of vaccination, it's absolutely clear that especially elderly people and the risk diseases react not so well. And they have more the tendency to develop side effects which are more worse than the effect of the vaccination which you would like. That's why it's an idea. There are also people that they would like to have, and other people, they will make a big business. It's also clear, but it's not a solution. And it's also according our understanding of regulation of biological laws and medicine, it's not a way. It's not a solution. At the end, it needs an individual concept and also more effective preventive things. We have so many things meanwhile available which are super helpful as prevention that I can let the vaccination. I am for myself, I wouldn't use, and I can also explain when necessary very scientifically how and why, but at the end
I'm going to ask you to come back.
It's a discussion. It's clear.
Yeah, let's do an entire show about that soon. Let's organize that, because you know, Dr. Ralf, I thank you so much for what you gave us today. I know we went a little long today for this 5th episode, but I will say that there has been nothing that hasn't probably opened a lot of people's minds. There's nothing that hasn't really educated them in a new way, in a new, different way, in a different approach. And hopefully it's not a new approach. Hopefully this is just confirming what you already know. That was most exciting to us. And if it's not, and you want more information, you can reach Dr. Ralf. We'll put all the contact information in the show notes. We'll be able to give his, well, not his email, but perhaps the clinic's email and the clinic's website. And Dr. Ralf, we just thank you so much for being a part of this. But before we leave, I want to ask you a question.
Please, please.
If somebody had to choose one thing to do for their bodies, and I'm kind of So if they had to, this is a new approach for them, they don't understand it. What is the one thing that you can suggest to them besides taking supplements and physical body stuff? What do you find is more important than any of the physical body stuff? I mean, I'm leading you into the answer, but you know, one of the things, when I met Dr. Ralf, let me back up. When I met Dr. Ralf, I was at a seminar. I was going to learn neural therapy, and I was a little late because I had a bit of a cold. I wasn't feeling that well. I had the sinus congestion. We had had some water in my basement. I was freaking out about mold, blah, blah, blah. And I decided to, of course, go to the seminar, because if I go to any seminar, it's going to be with amazing healing doctors. They're going to put needles on mine and help me feel better. So we go. I met him for 4 minutes and said, yeah, I'll volunteer. Please inject me. And I love his mosquito bites. And so he starts injecting, or before he injects, I said something like, oh, this is the cause. This is my cause for all my sinus problems, because I had water in my basement. I'm concerned about mold. I'm really sensitive to mold. And this is what it is. And like a leprechaun, which I met him on St. Patrick's Day, but like a leprechaun, and he's got red hair, like a leprechaun, he whispered in my ear, and I instantly started to cry, because he hit the nail on the head. He didn't know me. I had never met him. And what he said to me was, or it could be from all the stress and the one thing that you're trying to overcome. And I don't want to share with everybody what it was, because it was a very personal thing. And I literally thought to myself, felt to myself, how does he know that? Even though I'd been in this world for 20 years at that point. And I'm like, what an amazing, magical artist practitioner this man is, that's here to bring healing to the world. And I had had a ton of needles and put in my body throughout that. Nobody ever prayed over the injections like you did. Nobody gave the engagement with me that you have. And I watched you do it with clients throughout the years. And that is what's special about this medicine. So can you speak to that side of this world?
Yeah, I mentioned something. It's a question of this empathy, and that you are very strict to connect it, yes, with the willing to reach the best, and with love. And it's a logical thing. When you are suffering in the sinuses, you have also to think for the collection of, we say, stinky things. I hope it's in English the similar word. Yeah, things which you don't like to smell. And these are emotions very often, yeah, which we have incorporated, which we have deposited, but which we were not able to let go and to get rid. And parallel with injection or with similar things, we put in this, we say, healing information in, and then the system will make the rest. Is regulating, the tears are coming, and many, many other phenomena. And I see it almost every day that the people say, oh, what's on now? Within some seconds, it's like a complete switch in the system, and the doors are open, and the system is in a good flow. And so at the end, the key is also in this direction to say yes, to appreciate this wonder of life which you have, and to bring in the foreground the positive thing. Every day there happen also positive things. Yeah. Also, sometimes we have the impression the whole day was so terrible, but at the end, when we go in the deep, we see, oh, there was this wonderful word of this patient. There was this wonderful email of this friend. Every day we have also positive inputs. This we must bring in the foreground, and then it works. Yeah. And all these informations are absolute not new. Yeah. You can go in the famous book. You can look in the Bible. Love the others like yourself. Yeah, this is the key sentence. Yeah, like yourself. It means self-love. Yeah, and this goes only when we are also open in this direction.
I truly think you're one of the happiest people I've ever met in my life. I truly do. You have an amazing, I've never met anybody in your family, but I can only imagine being one of your children or grandchildren. You have like 12, how many, you have 10 grandchildren or something crazy?
No, we are a patch family. I have 4 children and 5 grandchildren. Yes.
Okay.
And my wife, she has 2 children, and meanwhile 3 grandchildren. Yeah. One grandchild died unfortunately due to a car accident, to be open, but also such things happen. And at the end, he is a part of my daily praying, and I give the input, please, accompany us with your spirit, perhaps coming from the other world. Yeah.
Well, you are an absolute breath of fresh air, and I'm sure that everybody here has felt that, and hopefully they have a much better understanding of how their body works. And absolutely, from our heart to yours, thank you so much. Make sure you subscribe to Not Meds, which is your naturally oriented therapist, your medically enlightened doctors and specialists. And you can see why I wanted to bring this information and why I work so hard to get these European doctors that really know what's up out to you so you can have access to them as well. And I wish you all the best. Subscribe, hit your notification button, and we will see you next time on the Beats with Kelly Kennedy, from our heart to yours. Thank you so much, Dr. Ralf, for being here.